Hello, my name is Ashley and my special population presentation will be on pain management and palliative care. What is pain management and palliative care? Palliative care is used throughout the course of an illness and it's integrated into disease-modifying therapies which are intended to either prolong life or also add to the quality of the client's life. Pain management can be used in conjunction with palliative care, or pain management can be used without palliative care. An example of palliative care may be a client or patient who is going through chemotherapy for cancer. Some of the results of chemotherapy can cause pain, and so the social worker would be working with them through their diagnosis of cancer, as well as assisting them with management of pain. And pain for a patient can be both physical and emotional, and it can be experienced subjectively. So that can impact someone's identity, their quality of life, and the quality of life for their family. Clinicians are there in palliative care to help affirm life and also affirm that dying is a normal progression of life. The treatment that a social worker offers is not to accelerate or postpone death, but rather to make their life more comfortable. Clinicians use psychological and spiritual facets of the client life to assist them in care, and they facilitate a support system with the team of medical people as well as with the family and support that the patient comes in with. Pain management and palliative care, again, can be used together or pain management separately. Both are used to improve the quality of life. Both can be for acute or chronic pain. An example of chronic pain might be something such as something that chemotherapy could give you as chronic pain, or a broken back. The result of a broken back could give you lifetime pain. Pain management can be needed because of an injury or an illness or disease such as fibromyalgia or arthritis, HIV, cystic fibrosis, and a number of other illnesses or diseases. Patients who come into palliative care are seeking treatment for either an incurable disease such as HIV or for a serious complex illness more like cancer. The purpose of it is again to prolong their life and the quality of their life. The identity impact of illness can have limitations on someone's physical and emotional health, and it can also affect how the patient connects with their family. So giving them resources to use after they move out of the facility is very important. Chronic pain can also cause symptoms of anxiety, depression, stress, sleep disturbances, and a number of other things. Working with a special population is different because a palliative care social worker must have specialty qualifications. They need to know a lot about disease and medications and symptoms. They must have a clear grasp on death. They should understand how to respond to pain, which is influenced by gender statistics. Women and men feel pain very differently, and studies have shown that women are often not treated for pain when men are. Sometimes because they're not reporting it or they feel it differently. Ethical concepts related to pain and palliative care are very important, such as end-of-life decisions. And it's important to understand and educate the team about the importance of the patient's and family's values, needs, beliefs, and goals related to respect for dignity of worth. Two of the major challenges that I've identified are the lack of adequate training and collaboration with a team and complex ethical and moral issues. Lack of adequate training during master's programs, there's very few opportunities to learn about palliative care. Oftentimes there's just an elective course. Pain has for a long time been viewed as a physical issue rather than an emotional issue. We're often under-resourced in areas that don't feel that this kind of work is necessary. In areas where they are working, sometimes it's difficult to manage the short amount of time with a patient. You have large caseloads, and there's a lot of competing priorities for the patient's well-being. And it's important for the team to understand your role and the impact you have as part of that team. And it's also important for the social worker to know the role of others. Some of the complex issues surrounding ethics are euthanasia, physician-assisted death, withdrawing, withholding interventions that may extend life, and dealing with a variety of different values. So patients, family, and clinicians all may have different values as regarding the end of life or pain management. How would I address these issues? I think that training is very important, and it's important for the social worker to advocate for themselves. You may speak to an employer to ask them to train you further, or ask them to give a stipend for specialty training courses. Use of supervision and mentoring is very important in increasing your knowledge, and so is self-study. You can also recommend that the team educate each other on their roles and how they impact the client's life. And lastly, you can utilize interprofessional team collaborative skills to assess your team collaborative skills and to make adjustments as necessary. Regarding ethics, I think it's important that you review your own code of ethics as a social worker, as well as the palliative care ethics that you can find under the NSAW. Also, I think it would be important to be familiar with medical code of ethics. And speak to your supervisor anytime that you think problems are arising that could interfere with personal or professional ethics. You can use psychoeducation to educate the family and the patient, and also the use of self-care is important, so to make sure you're preventing any kind of countertransference. What resources would I need as a social worker in palliative care? I think self-care is very important. Working with grief can be difficult. Utilizing a supervisor or mentor when necessary. Again, making sure you're educated on special areas such as disease and illness. You have knowledge around medication and dosing, and knowledge of working with people at end of life. Collaborative and interdisciplinary and potential other teamwork. So working with a team is very important. You can facilitate communication to really understand the patient on a variety of different levels. What resources would the client need? It's important that the social worker is providing resources for when the client leaves the health center, making sure there's family, friends, and a support system, making sure that the patient has an understanding of their diagnosis when they talk with the team. You can refer them to support groups or groups that do expressive art intervention. Assist them with setting up referrals through their medical team to occupational therapy, physical therapy, and other necessary interventions. Reach out to the community to make sure there's support there for the patient. Use psychoeducation to educate the client on the resources available to them. Refer them to counseling. They may also need assistance with health insurance, referral for disability, financial assistance, and again, transportation for appointments. How would I distinguish myself? I think one of the one ways to distinguish myself as a palliative care social worker would be to be very knowledgeable on the subject. Specialty training and pain management in palliative care is really important. Understanding disease and illness, knowledge of medication, and then understanding the multidimensional stages of death. Being an effective communicator is very important, communicating to the client, the family, and to your team. Advocating for the family, making sure that their values, beliefs, needs, and goals are met. And then validating the client on their feelings and showing that you understand and you're compassionate. And last, being able to provide a set of resources to a family and patient. So being very organized and having knowledge of the types of resources they would need. And my last slide is my references. Thank you so much for listening.